Hi, welcome to Let's Eat Cookies and Talk About Death. Tonight we're talking about death with dignity, also called medical aid in dying. And we're talking with Karen Retzer. Karen is the Midwest campaign organizer for Compassion and Choices. Her involvement in the end of life movement started in the spring of 2016 when she initiated an end of life study group at the Unitarian Universalist Church of Urbana-Champaign in Illinois. In January 2019, it became the Champaign-Urbana Compassion and Choices Action Team. Karen is going to talk about her involvement. She's going to help us understand what death with dignity, or as they tend to refer to it, and she can address this further, medical aid in dying, what it really is. She'll tell us about what's happening around the country. Some states have had laws on their books for quite a while. Illinois does not yet have a law, but she'll give us an update on what's happening there, and she will answer our questions. Okay, and I think we're just gonna get started. Do you want to add anything to that, Karen?
No, I don't. Thank you.
Okay,
And
I will
want
add,
to
and
also
maybe
say how glad I am. Thank you for this invitation.
great. I will also add that, like many people I've met involved in this movement, there was a personal story that drew her to it. So maybe that will work its way in as well.
Sure.
So, okay, great. So let's just get started. Tell us a little bit about compassion and choices. It's compassion and, when I heard it the first time, I thought it was compassionate choices, which would also fit, I think. But
Yes.
tell us about your organization.
Sure. Compassion and Choices is the oldest and largest national nonprofit committed to improving quality of care and expanding options around the end of life. And this organization is committed to empowering everyone to chart their own end of life journey. We educate, empower, and advocate, and really encourage each person to decide what they want at the end of life and to talk about that with their loved ones and with their doctors. So our work includes educating people about end of life options, including medical aid in dying.
Okay, great. And so tell us about the vernacular, death with dignity, or again, tell me why you prefer the term medical aid in dying, and then we'll talk a little bit about the laws.
What it is. Okay. We don't use the term death with dignity because we certainly recognize that deaths can be dignified without using medical aid in dying. And that said, it is a term, death with dignity, that used to be used to refer to medical aid in dying, and in fact still is by some people. But Compassion and Choices has chosen not to use it for that very reason, because we don't want to think that other deaths can't be dignified. And that said, we also know that some of the laws that have been authorized in some of the states use that name as part of their law. So it's not that but that's the reason that we don't use it.
Yeah. Well, and can I throw one more in there? Sometimes people talk about it being, they use the term suicide in there. And so tell me, I sort of bristle. Well, my son died by suicide, so I think that's a very different situation. But I would like to hear how you stepped away from that, or what you encourage. What do you say when you hear someone talk about that?
Yeah. Suicide, as personally, is just a very different thing. People who die by suicide are often very troubled and are not terminal, and have maybe, a mental illness that is causing this. And we find that people who oppose medical aid in dying refer to it as physician-assisted suicide, and throw in that term as a way to bring a negative connotation to it. And medical aid in dying is used by people who want to live, but they're dying. And so that's really the difference. And, even the American Association of Suicidology has recognized that medical aid in dying is just very different from what is usually thought of as suicide.
Yeah, I think this segues in great into the next question. You mentioned terminal, people who want to live but are terminal. So tell us about that. Who do these laws actually apply to?
Okay, so medical aid in dying laws allow a mentally capable adult with a prognosis of 6 months or less to live to request from their medical provider a prescription for medication that they can decide to take themselves to die peacefully in their sleep. So this is, the important, they're all important pieces here, but the important thing is that it's for terminally ill adults, and it is wholly voluntary, both for the patient and for the physician.
Okay, and when you say wholly voluntary, you said they have to take it themselves. What is a typical process? From talking to people, I think there's this perception that you just talk to your doctor and then something magical happens and you get a drug. What actually is the process?
Okay, so you do have to ask your doctor at 2 different occasions. And so you tell them what you'd like and you ask for the prescription. And then there is a waiting period. And the waiting period has been, when it was first brought in Oregon, was 15 days. And then you go again and you have to ask the doctor again for the medication. So it's 2 different asks, and 2 medical providers need to be involved and say that there is a the 6 month or less to live. So
And do those apply just in Oregon, or is that throughout all the states that have that law where you have 2 visits, 2 weeks apart?
right. So there are 2 visits, there's 2 asks. Okay, there's 2 asks. That's a good question, because what we have found is that in some cases, the people were so ill and suffering at the end that in Oregon, they are now allowed, the physicians are now allowed to not have the waiting period if they think that somebody is going to die in the interim. So they can waive that waiting period. And then in New Mexico, and I imagine that we'll talk about all the states that have authorized this, but New Mexico is the most recent one. And I believe there it's a 48-hour period between the 2 asks. So, and the reason for that is because the more lengthy period was really curtailing access for people who just really needed it. And so the laws are similar and different, right? So there are 2 asks, but they might vary by how long they are. There are 2 medical professionals. In some cases, it needs to be physicians. In other cases, it can be, physicians or anybody who can write a prescription. So I believe in the New Mexico law, it can be so in other words, physician's assistants. And this is really important for rural areas, for example, where there are fewer physicians. And so, being able to include other medical professionals, again, who can write prescriptions into it, is part of it. So,
And then is that part straightforward, or might someone go to a doctor and say, I understand the law and I'm terminal and these are my wishes? Is the doctor obligated to comply, or can the doctor assert their personal values into the equation and their comfort level?
absolutely. It is wholly voluntary, both for the patient and for the doctor. So doctors do not have to do this. No.
Okay. So, so if it ever is a law and this is something that a person wants to be prepared for, part of their screening for a new physician might include questions about this.
Absolutely. And you've touched on something important for many things in end of life care, is just having that dialogue, that open dialogue about whether it might be about medical aid in dying, but it might also be about deciding not to take certain treatments, not to take chemotherapy or radiation or, whatever, and making, having that conversation in whatever state you're in whatever,
Yeah.
sort of illness you've got, making a decision and choosing a doctor who's comfortable in doing what you want to do.
Yeah, no, that's a good point. I know my mother is in her 80s, as are many of her friends, and she said among themselves, they've discussed, some of them have decided they're no longer going to get a mammogram because in their mid 80s, they're not really prepared to, tackle something like chemotherapy if they needed it or foregoing certain tests. Yeah, just right.
Exactly.
There are other ways to make choices there are other choices one might wish. And I think I feel like Barbara Ehrenreich, if that's her name, wrote a book about that, about being in her 70s and deciding that she had certain thoughts about her future and didn't feel it was necessary to investigate every little, thing or take certain tests as she aged.
Yeah, absolutely. And I have not read that book, but exactly all of those, deciding, we can make a decision about anything that happens to us in the about our, in the,
Yeah.
when we go to the doctors. And often we don't know that, or we are intimidated by a doctor. But again, one of the things I said at the beginning with Compassion and Choices, we empower people to figure out what they want and to act on that and talk to loved ones and their doctors about it all along the way. Clearly not just about medical aid in dying, but all along the way.
Sure. And I think that's important because this is a really big end conversation that isn't going to apply to everyone, quite frankly. But I know I did poke around the website, but I don't recall. I think you do have discussion guides. Do you have discussion guides on there?
We have a lot of information.
Okay.
A lot of information about, medical aid in dying, about foregoing treatment, about a lot of different things, advanced directives. We've got information about dementia. So there's a COVID, if people have to make decisions, just to, not again, telling people what to do, but just helping people think through those different issues that they might encounter or loved ones might encounter.
Sure. And now, okay, you just mentioned dementia. Dementia is not something that these laws would apply to because it's not a terminal.
That is correct. Dementia, I believe, is terminal, but
Okay.
you have to be within 6 months of dying and be mentally capable.
Yeah.
And so,
so with Alzheimer's, that would also be a challenge to have both of those things.
Exactly. And so this is not something that people with dementia can make use of. There we have a dementia toolkit on the website that allows people to answer certain questions while they still are able to, along a spectrum of different things that might occur in their life, ability to recognize people or ability to know anything that's going on, you can imagine a spectrum, and then make decisions about how they would want their medical team to treat them or frankly, not to treat them in certain circumstances. And filling something like that out, there's a whole questionnaire, interactive questionnaire. And
Oh,
then at
great.
the end of that, you can print it out, and that can be part of your advance directive. And that can help guide somebody in the future if they're needing to make a decision about treating an infection with antibiotics or doing a whole variety of things. You can see what that person thought, when they were mentally capable, how they might have guided you.
Yeah. Okay, that sounds really handy. So thank you.
Yeah.
Okay, you mentioned Oregon, you mentioned New Mexico. I believe Hawaii also has.
Yeah, so 10 states and Washington, D.C. have authorized medical aid in dying, and a few have passed by ballot initiative. So Oregon was the first in 1994, and then Washington State and Colorado. And others have passed this through the legislative process. So Vermont in 2013 was the first state to go through the legislature, followed by California, Washington, D.C., and you mentioned some of these: Hawaii, New Jersey, Maine, and New Mexico was the most recent in 2021. And it is also authorized in Montana, but that was through a state Supreme Court decision. So there are 11 jurisdictions throughout, with 10 states plus Washington, D.C. who have done this. Yes, so.
That's still moving quite slowly
Well,
in terms of adopting.
it was in Oregon was 1994. I believe Washington was 2005, so that was a long time.
Yeah.
California, I think, was 2015, and several were since that time.
Oh, okay.
So really, there has been a, yes, these 11 have taken since 1994, but many of them have come out since 2015.
Oh, okay. That's
very,
interesting.
kind of very quickly. Yes.
Yeah. Okay. I mean, I did do that thing that all older people do, is where you say 1994, and I'm like, well, that was 6 years ago. Then,
that's right. That was a long time ago.
Yeah.
Yeah, I'm looking at a graph right now, and I'm seeing that Vermont was in 2013, California, Colorado, DC, Hawaii, New Jersey, Maine, and New Mexico have all been since 2015.
Okay, so there is some greater movement at this point, which brings us to, where are things in Illinois?
Yeah, where are things in Illinois? I will. So in Illinois, we are working. Compassion and Choices Illinois is co-leading a coalition called the Illinois End of Life Options Coalition with ACLU Illinois and Final Options Illinois. And together we are seeking authorization of medical aid in dying here in this state. We're working very closely with legislative champions to set the conditions for successful introduction and passage of legislation. So right now here, we are focused on educating the public, coming to events like this, and talking individually with legislators about medical aid in dying. And so we have no idea when this is going to happen. This is, of course, up to the legislature to decide, but we do not have a bill as of right now. Yeah.
Okay. And if people are interested in getting involved with advocacy, what do we just sign up for your email list, or what do we do?
Absolutely. You can sign up at, well, you could send me an email. First of all, I can give you my email address.
Do you want to put that in chat? Actually, we can do that when we're done talking.
Okay. Sure, I'll put that in chat when we're done talking. And people can sign up to volunteer at compassionandchoices.org/volunteer. And if you do that, you'll put in your address. And if you are in Illinois or anywhere in the Midwest, that will come directly to me and I will be in touch with you. You can also, and I encourage people, we live in a democracy, and I encourage you to be in touch with your state representatives, your state representative and state senator who are working in Springfield, to let them know your views about this, because they need to hear from people. They need to hear from people. So those are some concrete ways to get involved. And getting involved in with Compassion and Choices, we have volunteer groups throughout the state, several up in the Chicago area, and people are now going to all sorts of farmers markets or pride fests, or making presentations at libraries, all sorts of things to talk with people and to get the word out.
Great. Okay. I was just thinking about this today with this coming up. I mean, right now it feels like there are so many more pressing, immediate issues, but this really is a pressing issue for a lot of families. And I don't know, are you interested in telling us a little bit about how you got involved and why this is so important to you?
Sure, I will, but I'll talk about my story, which actually does not have anything specifically to do with medical aid and dying.
Oh, okay.
But I will tell you that what you just mentioned about the urgency, it is, I knew of somebody during COVID who got a stage 4 cancer diagnosis.
Mm.
And she said to me, wow, I wish we had this. And so yes, I will absolutely say there are many, many, many issues out there. This is an urgent issue.
Okay, we did get a question in, and this is the person required to be a resident of the state in which they request medical aid in dying? Are people permitted to travel to a state where they can access this?
It's a great question. Up until a couple of months ago, you had to be a resident of of all the states where you were doing this, which just meant that if you wanted to do this in another state, you had to go and gain residency.
Which another huge hurdle if you've got a terminal illness and limited
Exactly.
resources.
Which
Okay.
is another huge hurdle. And you might know of a young woman by the name of Brittany Menard. I see somebody nodding. Brittany was, she was not quite 30 years old. She developed a brain tumor.
Mm-hmm.
She lived in California, and she and her husband and mother moved to Oregon and took up residency, and she died using medical aid and dying. Not everybody has the wherewithal and the support and frankly the finances to do that. Now, I do want to say that very recently, as in a couple of months ago, the state of Oregon, a physician there won a lawsuit where people now can go to Oregon. They do not enforce the residency requirement in Oregon.
Interesting.
You still do need to go through the entire process there, have a doctor there, have your 2 requests, and fulfill all of the other requirements. So there is still the going there, but you don't have to become a resident.
Okay, so yeah, it still is quite an ordeal and resource intensive. But
Yes.
it's okay, but that's good to know that you don't have to take up residency there. Well, okay, I'll leave it at that. 2 questions that came in actually along a similar vein of how do we compare basically to other countries? If you know that, I don't know if you're familiar with how this plays out in other countries. Yeah, so how does it play out in other countries? And can Americans take advantage of that? And Debbie, I have something to talk about in our discussion afterwards, because it's not something that would fall under the USA, the current laws in the US, but a story about a memoir I just read where there's a situation. So yeah, do you have any, how are they doing it up in Canada, in Europe, Central South America?
You know, the laws do differ. The laws do differ. I'm not actually that familiar with them. I just know that they do differ. Yeah, and I'm not, I mean, I don't know enough that I should probably speak to it. They do differ.
Yeah. Okay, so this is another comment. I would imagine your group might draw attention from, quote, the elderly who don't want to become a burden on their loved ones and are interested in this topic. Do you find that that's the case, and are there resources you point them toward for those whose only ailment is being old?
Yeah, well, this is not something, medical aid in dying is only available for those who are terminally ill. And so the laws specifically state that age cannot be a basis for accessing medical aid in dying. And so you have to have a terminal illness. My own father, he lived here in Illinois, moved here from Michigan, but he was here in Illinois, and he had spinal stenosis, a lot of pain. But even had he lived in a state where medical aid in dying was authorized, he would not have been eligible for it. So he actually made a decision to voluntarily stop eating and drinking, which he did 3 years ago.
And I just want to jump in there and say that is allowed in every state. It is always legal for people to decide that they do not want to eat or drink. That doesn't mean that people around them will support them, but yeah, sorry. So go on. So he made that decision for himself.
He made that decision. And if one does choose to do that, you do need the support around you. But again, and I say that to emphasize that it's not just because of age or a lot of pain, or that you have to have a terminal illness. And two physicians say that you've got an illness that is going to, that is terminal within 6 months or less.
Yeah, I can see both sides of it, how there are people who say I'm in pain and I would like to not be in pain. I've lived my life and I'm ready to say goodbye. But legally, that's such a slippery slope.
Right.
Yeah.
And so it's very clear that people have to have that terminal diagnosis.
Yeah. Okay. So we have another question. Does your organization advocate for more expansive laws than what currently exists, such as in the state of your father, or you're really focused on the terminal illness?
Right. We do
aspect?
not advocate for anything that is, we don't advocate for things that are beyond. It's important that people have a terminal illness and they're mentally capable to do this. Yeah.
So that's probably a very large safeguard.
It is a safeguard. It is a very large safeguard, and it's an important safeguard. That's absolutely right. Another safeguard is that if somebody believes that depression is playing into this or something, that the physician must send the patient to another, for a psychiatric evaluation. So there are lots of safeguards. These laws, especially in Oregon, have been on the books for, a long period of time, not 4 or 5 years, since 1994. And there have not been any, causes for concern along these lines.
Something else I just want to make sure we mention that just occurred to me is how powerful it can be just to feel like you have, like a person has the choice, and when a medical condition is terminal and out of their control, feeling like they have some control over the situation. And I've heard that a lot of people go through the hoops, they get all the permissions and they get the medicine and die before taking it. So I think just there's some power in just feeling like people might have control in that kind of situation. And do
Absolutely.
you know how often that happens? Any
I
statistics on
think
that?
about 30% of the prescriptions that people get are not taken, 30%. And so you're absolutely right that we have heard, and I can imagine that people who just want to know that they have the ultimate option to do this. And that
Yeah,
just brings a lot of, just lessens the anxiety around
yeah,
um, that fear of what might come. And 30% don't take it, which also just shows that it's voluntary up until the end. Yeah.
right. Well, thank you very much. Thank you for educating us on compassionate choices and why we should use the term medical aid in dying and what that really means. I really appreciate you being here with us tonight.
Well, thank you very much again. Thank you.